The following segment is sponsored by Center for Sports Medicine.
And we've got Dr. Benjamin Geddes joining us. He's an adult and child spine surgeon for Center for Sports Medicine and Orthopaedics. I'm glad you're with us because I've got a lot of questions for you when it comes to this robotic spine surgery. Now, I remember a couple of years ago we were talking about this because it was fairly brand new. How long has robotic spine surgery even been in existence?
Yeah, I mean, it's been evolving over the last several years, and several companies have started to kind of dabble in it, and it's really progressed over the last couple of years, like you said. And here in Chattanooga, I believe they got the first robot about a year or two ago. So it's relatively new technology, but it's been used for a couple of years now.
How has it changed with you as a surgeon in the operating room?
It's just like anything. It's a tool, and it's a really cool tool that does help us do certain things. For the right patient, you can do a similar surgery through a smaller incision, less blood loss, and it just gives you a way to place a really accurate screw, which is something that we do in some surgeries. We try to avoid the fusion surgeries, obviously, but in the right patient that needs it, this is a tool that can really help us do the job. And it's just the applications continue to kind of evolve over time as the technology evolves.
I'm thinking of this type of procedure less invasive, correct?
Yeah, that's really the goal. I mean, obviously, when I see a patient, the vast majority of spine pathology can be treated non-operatively and, with therapy and sometimes injections. But, for the right patient that needs a fusion type surgery, this is just another tool in our tool bag that helps us do a little bit better, safer surgery. And it's just fantastic that a place like Chattanooga just has this kind of technology available to us.
And who qualifies for this type of surgery?
So patients that need a fusion surgery, in my hands, I usually do it for degenerative applications. So people that have arthritis of their back, typically that have some instability in their spine, meaning that one kind of bone slips on the other. And it's a pretty common issue that we see in the spine world. And for that patient, a decompression or just taking pressure off the nerves alone isn't enough. And so typically they need a fusion type surgery with screws and rods. And so for that patient, I think this is a really good application for the technology.
And Dr. Geddes, when it comes to recovery time, this new technology or technology that, like you said, it's been out for a few years, it's got to reduce it drastically.
Yeah, it's interesting for this type of fusion surgery. 10 years ago, patients were in the hospital frequently for up to a week to recover. And now, it's a combination of anesthetic and the new technology, but we're able to get patients out in a day or two typically.
Now, I was reading in your title a few moments ago, you're an adult and child spine surgery. When it comes to children with this type of technology, I guess you work on a lot of children in our community?
Well, the application that people have started using the robot for in children is mostly scoliosis surgery. So children that have a curve that's big enough that requires surgery, again, which is kind of the minority of patients, but the ones that need it, we use things like navigation and more historically things like X-ray in the operating room. But now this is another option to place these screws, which are necessary to correct that curve just more safely and accurately.
Unbelievable. Technology is an amazing thing, right?
It really is. It really is.
Yeah. Well, thank you very much for your time. We'll let you get back to your patients. Dr. Geddes with Center for Sports Medicine and Orthopaedics. You guys do such a great job. For more information about everything we just talked about here in the last 4 minutes, 423-624-2696. Outside of Chattanooga, 1-800-757-2696.